Hi, I'm Cassie. This is my insulin demo, continuous IV. Okay, so the first thing we're going to do is we're going to look at our physician's order and compare it to our MAR. So we'll compare the name, Bryson, Scotland, compare FIN numbers, 1, 2, 3, 4, 5, 6, 7, 8, 9, that matches. And then we're going to compare the medication order. So we've got insulin, Humulin R, continuous IV at 2 units per hour. Humulin R, continuous IV, 2 units per hour. So that matches up. We're signed here, so everything's good. So then we're going to grab our vial, and we're going to compare our vial to, and we'll also grab our PDM. So we've got insulin Humulin R for our PDM, that's what's ordered, insulin Humulin R, and that's what's in our vial. So that all matches up. This is 100 units per milliliter. So we'll go over to our PDM and Humulin R, everything's right. So we'll go through it and we'll see IV continuous, maybe delivered by nurses or nursing students. It says minimum monitoring parameters. After the first dose, we do Q1H, and then once we're in the range, the glucose range we want, we'll go to Q4H. And we want to make sure that we have D50W ready on the unit, just in case they have a hypoglycemic episode. So we'll go through, and so IV infusion, or IV continuous, sorry. We've got 10 units per hour being in the safe range. So our doctor ordered 2 units per hour, so we're in the safe range. IV continuous, it says we have to add 100 units, and we'll use our 3 milliliter syringe with our blunt fill needle and drop 1 milliliter of 100 units per milliliter insulin. So that's this. And we're going to inject the 1 milliliters into our mini bag, which is 100 milliliters of normal saline, and we will double check the compatibility. Normal saline is compatible, so that's good. We're also going to want to be aware of signs of hypoglycemia and inform our patient of that. Okay, so our drug recipe, 100 units, so that's 1 milliliter of 100 units per ml. So we're going to need that added to 100 milliliters of normal saline for a final volume of 101 milliliters and a concentration of 0.99 units per milliliter. So we'll open up our things here, and we'll clean our insulin. Okay, clean for 30 seconds, let dry. There we go. 1 ml. Go. Make sure we have 1 ml. Perfect. We'll scoop. And then we're going to label our insulin here. So insulin Humulin R. And we've got our date. We've got our amount too. We've got 1 milliliter, which equals 100 units. We've got the date of March 28th, date 1830, and initial, and we'll put our room number. So we'll label our one. While we're here, we can do our label for our bag too, and our line. So Humulin R, we've got the room number, 100 milliliters, equals 100 units. We're going to put our order on here. So we want continuous IV at 2 units per hour. We're going to do our concentration equals 0.99. We've got our, we know our dilutant there, but we'll do a total volume of 101 milliliters. Now we'll put our date, our time, and our initial. We'll have that ready, and we'll do one for our line as well. So we've got Humulin R, and we've got, we can put at 2 units per hour, room number, you can put our patient's name if you want. We'll put our March 28th, 1830, our initials, and that's good. So we'll have that ready for that. Now we're going to do a check. We're going to compare all of our things here. So we've got right patient. So we've got our patient, Bryson Scotland. Okay, and he's receiving Humulin R. So we've got Humulin R here. That's what's ordered. That is what it's in our vial. Humulin R, and our thing says Humulin R. Our dose is going to be 2 units per hour. So 2 units per hour. And we've got 2 units per hour on here, and that is within the safe range on our PDM, so that's good. Route is going to be IV continuous, and the time is going to be right now. So everything's good. We can get a second nurse at this time to come check. And she says this all looks good, so we can put it into our bag. Just clean. 30 seconds, let dry. And then we can inject our 1 milliliter of insulin, which is going to be 100 units. And we'll dispose of our thing, and we'll label it right away. Okay. Now we can go ahead and prime our line. So this would normally be portless tubing, but we don't have any, so we're going to use this for the video. Remove all of this. And make sure all of our clamps are closed. Up. That's good. Just make sure everything's in order. And we will spike our bag. And we can fill up our chamber a bit. There we go. And now we're gonna try and do this slowly so we don't waste any. So we'll just open up our clamp. There. Now we'll check for bubbles. That's pretty good. Okay, so that's good. So we can take this and put our label on our line too now, actually. Since we're here. And then we're ready to go to bedside. So we will take our meds, and we'll take some alcohol swabs, we'll take our MAR and we'll just review our hypoglycemia, hunger, sweating, palpitations, and loss of consciousness. So that's good. So yeah, we can go to the bedside. So we'll do our hand hygiene, we'll introduce ourselves, we'll get our patient identifiers, ask him to verbalize his name, and we're also going to compare our MAR with our med with the wristband and make sure everything matches up. So everything's Scotland Bryson, 1, 2, 3, 4, 5, 6, 7, 8, 9, and that's all good. So I'll just hang our meds right here for now. And now we'll just explain to him like what the insulin is for. So we'll tell him the doctor ordered you insulin because your blood sugars are a little high. This is just to keep them under control. And then you can give him some side effects of it. So hypoglycemia, so if he's feeling hungry or thirsty, or if he feels like he's gonna lose consciousness, then to ring his bell right away and let us know if he has any sort of symptoms. We will give him the right to refuse here at this point too. We're going to tell him we'll be back to check on him every hour after the infusion starts to check his blood glucose until it's in the normal range. Then we'll switch to every 4 hours. We're going to assess. First, we check his blood glucose, obviously, to make sure he's not hypoglycemic, and we'll check the patency of his IV that's running here, and we'll look at his IV too. We see he's got normal saline running by gravity, TKVO, so that's good. Now the clamps are open. So now we can go ahead, he's agreed to have his insulin, so we can go ahead and set up our pump. So we're going to open up our pump. Select milliliters per hour, so we're going to open up our pump. Open our pump. There we go. Okay. All right. So we've got this loaded. Now we're gonna do, we know the concentration of our bag is 0.99 units per milliliter, and we want to run it at 2 units per hour. So we're gonna go 2 milliliters per, our volume is 101. And so that's good. Now at this point, we could get a second nurse to come in and she would double check the patient identifiers along with the rate, and she says everything's okay. So we can go ahead and attach our IV here. So we'll clean the IV side. And we're going to attach, make sure all our clamps are closed for now. And then we'll attach. And there we go. So we'll double check again. just to be safe, 2 units. So that's 2 milliliters per 100 units. So everything's good, so we can confirm primary and we can hit start. And then we'll make sure all of our clamps are open on our carrier bag as well as on our insulin infusion. We've assessed the site already. It's patent, it looks good. He says there's no warmth and no problems with it. Now we can lock our pump and we will do our final safety check. Explain to him again if he's feeling any signs of hypoglycemia or any changes in his state to be sure to ring the call bell. Tell him we'll be back in an hour. We'll put our bed down, do our last safety check, and then we'll go document.